Thank you for selecting the GLUCOCARD Expression Blood Glucose Monitoring System. Frequent blood glucose monitoring is important. It tells you how your diabetes is affected by factors such as medication, diet, exercise, and stress management. Blood glucose test results can also tell you if your diabetes is changing in ways that affect your treatment plan. Always consult a healthcare professional before making any changes. The GLUCOCARD Expression Blood Glucose Monitoring System is for self-testing. It provides a fast, easy, and accurate method of determining blood glucose readings. This training video will provide basic instructions for using your GLUCOCARD Expression Blood Glucose Monitoring System. Please read the GLUCOCARD Expression User Instruction Manual for complete instructions before using the system. For additional assistance after reviewing these materials, please call ArcRay Customer Service at 800-566-8558 or visit us at www.glucocardusa.com. Getting started. Your GLUCOCARD Expression Meter system includes a GLUCOCARD Expression Meter, User Instruction Manual, Carrying Case, Self-Testing Logbook, and may also include test strips, control solution, lancing device, and/or lancets. Now, let's take a moment to become familiar with the GLUCOCARD Expression Meter system. Key points of the meter include meter display, enter button, left and right arrow, test strip port, battery compartment, and data port. On the back of the meter, you will find your serial number and customer service number. Meter setup. Before using the GLUCOCARD Expression Meter system for the first time, you must set up your meter to ensure your results are appropriately marked in the system memory. In the setup mode, you can set up the time and date, alarms, voice and beep function, volume, and language. The setup screen of the GLUCOCARD Expression Meter lets you take advantage of the GLUCOCARD functions of this meter. To access the setup screen, press and hold the Enter button to turn the meter on. Press the Enter button again to enter into the setup screen. From there, simply use the left and right arrows to navigate to the desired function icon, and press the Enter button to enter the desired function. The meter will also announce each function when the voice feature is turned on. The meter functions include memory recall, PC link mode for data transfers, time and date, alarms, volume, and language. To set the clock, press the left or right arrow until the clock icon is highlighted and begins to flash. If the voice function is on, the meter will say, Set Date and Time. Press Enter to enter clock setup. From here, you will set the current year by pressing the left or right arrow until the correct year is displayed. Press Enter to confirm your choice, and the screen will advance to set the month. Again, press the left or right arrow until the correct month is displayed. Press Enter to confirm your choice, and the screen will advance to set the day. Again, press the left or right arrow until the correct day is displayed. Press Enter to confirm your choice, and the screen will advance to the time format setting. From here, the current time format will flash. Press the left or right arrow to select either 12-hour format or 24-hour format. Press Enter to confirm your choice, and the screen will advance to the hour setting. Again, press the left or right arrow until the correct hour is displayed. Press Enter to confirm your choice, and the screen will advance to set the minutes. Again, press the left or right arrow until the correct minute is displayed. Press Enter to confirm your choice and finish setting the clock. After the date and time has been set, the meter will announce the date and time if the voice feature is on. Note that you may need to reset the time after changing batteries. Your GLUCOCARD expression comes equipped with 3 alarms. To set the alarms, press the Enter button on your meter to enter setup mode. Press either the left or right arrow until the alarm clock icon is highlighted and begins to flash. Press Enter to enter the alarm setting. From here, the display screen will indicate Alarm 1 status. The default is off. You can turn the alarm on or off by pressing either the left or right arrow. Press Enter and the hour will flash. Press either the left or right arrow to select the hour. Press Enter to confirm your selection and the screen will advance to the minute setting. Again, press either the left or right arrow to select the correct minute. Press Enter to confirm your selection and the screen will advance to Alarm 2 and 3. Repeat the same process used to set Alarm 1 for Alarm 2 and 3. Once you are finished setting up Alarm 3, press Enter to exit the alarm setup. To set the volume on your GLUCOCARD expression, press the Enter button to enter setup mode. From here, press either the left or right arrow until the volume icon is highlighted and begins to flash. Press Enter to enter the volume setting. From here, the screen will display the current sound volume. Default setting is level 2. Press either the left or right arrow to adjust the sound volume from 1, lowest, to 5, highest. A melody will sound according to the sound volume you have selected. Setting the volume to 0 will turn off the voice function. When the voice is turned off, the meter will beep to alert you of important messages. Once you have determined the suitable volume, press Enter to exit volume setting. Your GLUCOCARD expression meter has a bilingual voice function that can be used as a verbal aid for using the meter and hearing test results. To set your language preference, either English or Spanish, press the Enter button to enter setup mode. From here, press either the left or right arrow until the talking icon is highlighted and begins to flash. Press Enter to enter the language setting. English is the default language for your GLUCOCARD expression meter and can be changed by pressing the left or right arrow. Select 1 for English and 2 for Spanish. Press Enter when you have finished selecting your language preference and you will exit the language setup screen. Replacing the batteries. Your GLUCOCARD expression runs on 2 alkaline AAA batteries. Batteries need to be changed when the battery icon appears on the meter display. To do so, press firmly on the battery cover and pull it back. Insert new batteries and slide the battery cover back into the meter firmly. Note that the meter will prompt you to reconfirm the date and time when turned on. The date, stored results, alarm settings, volume setting, and language choice remain in memory when the batteries are changed. Performing a control solution test. The purpose of the control solution testing is to make sure the GLUCOCARD expression meter and the GLUCOCARD expression test strip is working properly. You should perform control solution testing when using the meter for the first time, using a new bottle of GLUCOCARD expression test strips, you left the test strip bottle cap open, you dropped the meter, you suspect your meter and test strips are not working properly, the blood glucose test results do not reflect how you feel, you want to practice the testing procedure. To perform a control solution test, you will need your GLUCOCARD expression meter, control solution, and a new GLUCOCARD expression test strip. To begin, remove a GLUCOCARD expression test strip from the test strip bottle. Close the bottle cap immediately. Insert the test strip to turn on the meter. Wait until the flashing blood drop and arrow icons appear on the meter display screen. The meter will also announce, "Please apply blood onto the test strip," if you have the voice feature turned on. Press the right arrow to enter L1 Control Solution Testing. The CTL icon will appear next to the test strip icon, and L1 will appear on the meter display screen. The meter will also announce L1 Control Solution Test. Please apply control solution onto the test strip. If you decide not to do a control solution test, press the left arrow until CTL disappears from the meter display. To begin, squeeze a drop of control solution onto a clean, dry, non-absorbent surface. Do not apply control solution to the test strip directly from the bottle. Replace the cap on the control solution bottle immediately after use. Next, gently touch the drop of the control solution to the tip of the test strip. The meter will beep, indicating it has received the control solution. The screen will start to count down. After 6 seconds, the control test result will appear on the meter display screen. Compare the reading on the screen to the level 1 range printed on the test strip bottle or its package. If the reading falls outside the level 1 range printed on the test strip bottle or its package, see Control Solution Troubleshooting on page 39 of your owner's manual. If the result falls within the range, your GLUCOCARD expression meter and test strips are working correctly. Remove the used test strip. The meter will automatically turn off. Discard the used test strip into a proper waste container. Follow these steps again to complete a Level 2 control solution test, and compare the results with the Level 2 range printed on the test strip bottle. Note that the control solution test results will be stored into the meter memory and indicated by the CTL icon. Control solution test results will not be used for calculating averages. Testing your blood glucose. To perform a blood glucose test, you will need your GLUCOCARD expression meter, a new GLUCOCARD expression test strip, and lancing device with a clean, unused lancet. With the GLUCOCARD expression meter, you can perform a finger sample or alternate site testing on the palm or forearm. Note that if you are using alternate site testing, you will need to use the wide-tip lancing device cap. To begin, you will need to prepare your lancing device. Remove the adjustable cap by twisting the cap off the lancing device. Insert the lancet by pushing down firmly until the lancet is fully seated. Twist the lancet protective cover off and attach the adjustable cap by twisting clockwise onto the lancing device. Adjust the depth level on your lancing device for the desired puncture depth. 1 is the lightest and 5 is the deepest. With one hand holding the adjustable cap, pull back the lancing device with your other hand until you hear a click. The lancing device is now ready for blood sampling. To begin, wash your hands with soap and warm water and dry thoroughly. Warm water stimulates blood flow to the fingers, making it easier to obtain a sample. Next, hang your arm down at the side for 10 to 15 seconds. Massage through the wrist, palm, and then the finger. This can stimulate the blood flow to the finger more quickly. Before performing a blood glucose test, check the expiration date printed on the test strip bottle. Do not use expired test strips. When opening a new bottle of test strips, record the date opened on the bottle label. Discard the bottle and any remaining test strips after 3 months from the date you opened the bottle. To begin, remove a GLUCOCARD expression test strip from the test strip bottle. Close the cap immediately and insert the test strip to turn the meter on. A flashing blood drop and arrow icon appears on the meter display screen. The meter will announce, "Please apply blood onto the test strip," if you have the voice feature turned on. Next, obtain a blood sample. For fingertip testing, use the narrow tip adjustable cap on your lancing device. Hold the lancing device against the side of your fingertip and press the release button. Gently bring the test strip to the drop of blood at a slight angle. Keep the test strip in the blood drop until the meter beeps to indicate the test strip has enough blood. The screen will start to count down. After 6 seconds, your glucose test result will appear on the meter display screen and announced verbally if you have the voice feature turned on. Your test result will be automatically stored into the meter memory. Remove the used test strip and discard in the proper waste container. The meter will automatically shut off. Remove the used lancet from your lancing device and discard into the proper waste container. Alternate site testing. The GLUCOCARD expression can test blood glucose from areas other than your fingertip, such as the palm and forearm. Note that the technique for alternate site testing is different than for fingertip testing. You should consult your doctor before using alternate site testing, as results from alternate sites may be significantly different than the results from the fingertip. You should do AST only in the following intervals: in a pre-meal or fasting state, more than 2 hours since the last meal, 2 hours or more after taking insulin, 2 hours or more after exercise. Alternate site testing should not be used when you are experiencing hypoglycemic unawareness, unable to tell if you have low blood sugar, within 2 hours of a meal, exercise, or medication. You will be operating machinery or driving a car. You are sick. You think your blood glucose is low. Your AST results do not match the way you feel. You are testing for hyperglycemia. Your routine glucose results are often fluctuating. To begin, wash your hands and testing site with warm water and soap and dry thoroughly. To begin, you will need to prepare your lancing device. Remove the adjustable cap by twisting the cap off the lancing device. Use the wide tip adjustable cap for your lancing device for alternate site testing. Insert the lancet by pushing down firmly until the lancet is fully seated. Twist the lancet protective cover off and attach the adjustable cap by twisting clockwise onto the lancing device. Adjust the depth level on your lancing device for the desired puncture depth. 1 is the lightest and 5 is the deepest. With one hand holding the adjustable cap, pull back the lancing device with your other hand until you hear a click. The lancing device is now ready for blood sampling. Hold the lancing device against the testing site, either palm or forearm. Avoid a test site that has veins, moles, excessive hair, or bone. Press the lancing device firmly against the test site and press the release button. Hold the lancing device in place. For forearm test sites, apply and release pressure for a few seconds while keeping the lancing device in constant contact with the skin. Palm testing does not require this technique. When the blood drop is large enough, lift the lancing device straight up without smearing the blood sample. Gently bring the test strip to the drop of blood at a slight angle. Keep the test strip in the blood drop until the meter beeps to indicate the test strip has enough blood. The screen will start to count down. After 6 seconds, your glucose test result will appear on the meter display screen and announced verbally if you have the voice feature turned on. Your test result will be automatically stored into the meter memory. If results from alternate site testing do not agree with how you feel, use fingertip testing. Remove the used test strip and discard it in the proper waste container. The meter will automatically shut off. Remove the used lancet from your lancing device and discard into the proper waste container. Viewing the meter memory. Your GLUCOCARD expression meter automatically stores up to 300 test and control results with date and time. The meter also provides 7, 14, and 30-day averaging to help track your blood glucose trends. Note that you must set the date and time on your meter to use the memory and day averaging function. The meter will not store test or control results in the memory if the date and time are not set. To view your stored readings and the 7, 14, and 30-day averages, you will simply need your GLUCOCARD expression meter. Press and hold the Enter button to turn the meter on. Press the Enter button again to enter the Setup screen. From here, press either the left or right arrow until the MEM icon is highlighted and begins to flash. If the voice function is turned on, the meter will say Memory Recall. Press Enter to confirm. MEM will appear at the upper left corner of the display screen together with your most recent test result. Press the right arrow to see the next result and the next, and so on. Holding the right arrow will scroll through the test results. NIL will appear on the display screen after the last recorded test result if less than 300 readings are stored. To view your averages, press the left arrow once you are on your most recent test result. The meter will display the 7-day average. Press the left arrow again to see your 14-day average. Press the left arrow again to see your 30-day average. Note that control testing results are flagged by CTL on the bottom left corner of the display screen. If the meter memory is full, adding a new test result will cause the oldest to be deleted. The GLUCOCARD Expression Blood Glucose Monitoring System is a safe and reliable way to monitor your blood glucose levels. To get the most out of your GLUCOCARD expression meter system, please refer to your owner's manual or contact ArcRay Customer Service at 800-566-8558 or visit us at www.glucocardusa.com.